Bine v-am regăsit, doamnelor, domnilor, aici la Sănătatea Fără Frontiere. V-am obișnuit alături de noi în studioul Observatorul Prahovean, prin intermediul StreamYard, de acolo din Istanbul, medici de top. Astăzi, alături de noi, se află profesorul dr. Cengiz Gemici. Domnia sa este medic specializat pe radio-oncologie. Hello, doctor. Nice to see you. Nice to talk to you. How are you?
Thank you very much. And you, how are you?
Fine, thanks. Just waiting to talk to you because I prepared a lot of questions for you. Very important questions with very important answers from you, of course, for our Romanian viewers. So we start the interview, Dr. Gemici, okay?
Okay.
Okay. I want to know what is radiotherapy and how is it administered?
Yeah, radiotherapy is one way of cancer treatment. In cancer, we have three major type of treatment. One is, surgery, and mostly we operate the patients when there is a diagnosis of cancer. And the second way of treatment is radiotherapy, which is nearly equal to surgery in cancer treatment. And the third way of treatment is chemotherapy. There are nowadays other types of treatments like smart molecules and immunotherapy treatments of the cancer, but majorly we will talk about these three types of treatments: surgery, radiotherapy, and chemotherapy.
I
How
understand.
does
Okay,
yeah?
please, I'm listening. Sorry.
How does radiotherapy works? Radiotherapy is to give high energy to the tumor, and by this way we disrupt the genetic materials of the tumor, and we disrupt the DNA. DNA, which is
Yes.
important for most of cells. And when we disrupt the tumor DNA, the tumors lose their ability to replicate and to live, and by this way they die. And in when we treat the cancer patients with surgery, we remove the tumor from the organ, and we use knives, scalpels. Surgeons open the patients and then remove the tumor from the organ, and they do it by their knives or scalpels. But we, as radiation oncologists, we disrupt the tumor in its place without a scalpel, without opening the patient, and without any anesthesia. We give high energy X-rays to the tumor, and we disrupt the genetic material of the tumor, and the tumor dies in its place.
Before I continue, doctor, I understand from you that radiotherapy is a modern procedure. Am I right?
Radiotherapy, in fact, is an old treatment. Nearly 120 years we use radiotherapy from the invention of X-rays by Wilhelm Conrad Röntgen, and gamma rays from Marie Curie. These people are Nobel Prize winner people. They are very famous. They are very well known, and they invented radiotherapy. And from the invention of X-rays and gamma rays, we use radiotherapy. But there is, of course, technical and computer technological advances which made radiotherapy very high technical and sophisticated treatment.
I understand.
At those days, we were treating, beside tumor, most of the normal tissues around the tumor, and we, as radiation oncologists, at those days created normal tissue complications. And nowadays, radiotherapy is tumor-specific treatment, targeted treatment, a smart treatment. The technology now permits radiotherapy very smart. do it radiotherapy as a smart way of treatment.
Okay, doctor, please tell me at what stage and with which kind of treatments is radiotherapy administered in cancer problems?
Luisa, before going to this question, I will talk about the organ preservation by way of radiotherapy. As I
Please.
said before, the surgeons remove the tumoral organ. Let's give an example. In larynx cancer patients, when the surgeon operates a larynx cancer patient, they remove the larynx and they put a hole here in the neck, and the patient loses its speaking capabilities. And due to the loss of the larynx, the patients, although they are cured from the cancer, they cannot speak. You know, you saw some patients with a hole in their neck.
Yes.
But with radiotherapy, we preserve organ and we preserve larynx and we kill the tumor while preserving the organ. By
Without
this way,
affecting the voice of the patient?
yes, by
I
this
understand.
way, the patient preserves his larynx or her larynx, and then, although cured from the cancer in the larynx, they can speak normally, and by this way we preserve the organ. Another example, you know, the breast cancer patients, normally the surgical treatment is mastectomy. What does it mean? The removal of the breast tissue. But today, you know, the surgeons get out only the tumor in the breast, not they get the breast whole, the breast tissue. And this is possible with radiotherapy. And the woman can preserve their breasts. And this is very important for women to preserve their physical appearances. Another example, the organ preservation. For example, rectal cancers. You know, the rectum is the distal part of the colon. The surgical treatment is total abdominoperineal resection, which means that the removal of the rectal organ, and the surgeons put a pouch on the surface of the skin in the near abdomen, and the patients cannot defecate normally, and they have to hold this pouch lifelong. This is a disturbing situation for the patients, the cosmetic appearance and the maintenance of the pouches. And by radiotherapy, we can preserve rectum and the patients can defecate normally. You see, I can give many examples, this kind of cancer treatment examples, where the organs are preserved by way of radiotherapy. This is very important.
Yes, I understand what you're saying, doctor. Please tell us. It's a curiosity. Let's say, what is the most challenging area for you as a doctor, of course, in radiotherapy?
You know, radiotherapy now is a very sophisticated. We have very sophisticated machines nowadays, and there is no challenge, in fact, with the technological achievements. For us as radiation oncologists, we had difficulty to treat tumors that move. What does it mean? What I mean? For example, a tumor in the lung or a tumor in the liver, they don't stay still in their place. When we practice radiotherapy, they move with respiration. They go upwards and downwards. This is a difficult situation for a radiation oncologist because we have to compensate for the movement to treat the tumors. There are several ways of compensation. One is to either increase our radiation fields, which is not preferred mostly because, you know, when we increase our radiation fields, although we treat the tumor, the normal tissue complications also increase. Another way is to compensate for this movement. Now we have different technologies for movement compensation. One of the technologies is called surface guided radiation treatment. This is a new technology. It is a high tech solution to compensate for the movement. For example, we can now decrease our movement of the tumor in the lung, in the liver, in the abdomen with this technology, and we just treat the tumor, not the most of the normal tissue around the tumor. We
Okay,
have this
doctor,
technology. Yeah.
you
Yes,
spoke
please.
about the movement of the organ. What is exactly the movement of the organ, and how do you handle and manage the movement of the organ in your clinic?
As I said, we have a special technology for movement management, and this technology is called surface guided radiation treatment. And here we have a special cameras, infrared cameras. They give thousands of lights to the surface of the patients during radiation treatments, and we know where the tumor is exactly, and depending on the surface of the patient, and we can highly localize the tumor in its place in different phase of the treatment cycle and respiration. In our
Yes.
clinic, we have a special technology to compensate for the movement and respiration. Uh, we use align RT radiotherapy surface guided treatment. What does it mean? During the treatment, the patients lie on the table, and the infrared cameras send infrared light to the surface of the patient. And
Okay.
by this way, we get three-dimensional structure of the surface, and we know where exactly the tumor is found in which phase of the respiratory cycle, and we can highly precisely treat the tumor and compensate for the respiratory movement. It is a difficult task to explain this to you, but this technology allows us to treat the tumor, just the tumor, not the normal tissues around. And by this way, we get very effective cancer treatment while preserving normal tissue toxicity.
So, doctor, radiotherapy means localizing the tumor without affecting any healthy tissue, as
Yeah,
I understand.
it can be said shortly, as you said.
Yes.
You are right.
Okay. And my last question, doctor, for you, you spoke about breast cancer. That is one of the most common type of cancer in women. How do you treat a breast cancer patient there in your clinic?
Yeah, with achievements in surgical techniques, with achievements in medical oncology, and with achievements in radiation oncology, the breast cancer patients are cured more with respect to 10 years, 20 years ago. One of the main issue with radiation treatment of breast cancer is the toxicity of the radiotherapy on heart. You know, uh, breast is a organ which is situated on the thoracic wall, on the thoracic surface, and just beneath thoracic surface we have heart lying beneath thoracic surface. You understand what I mean?
Yes. Yes, I
And the
understand.
breast is found on the thoracic surface. And when we irradiate breast, we may harm the heart lying beneath thoracic wall.
So what do you
Uh,
do then?
yeah, what we do again, this surface guided radiation treatment technology. We tell the patient to take a deep breath and hold the breath, and we know where exactly and when exactly to irradiate the breast. For example, when you get a deep breath, the thoracic wall gets away from the heart. You imagine when
Yes.
we leave the breath, the thoracic wall gets on the surface of the heart.
So
When we take,
those seconds are very important.
yeah, yeah, we tell the patient to take a deep breath, and by taking a deep breath, we get away the breast tissue from the heart,
I
and
understand.
we irradiate the breast only at this cycle of the breathing, and this is possible by our surface guided radiation treatment technology, and by this way we preserve heart from the toxicity of the radiotherapy, and the patients don't have any problems in their future with the heart, and we get just the right radiation to the breast tissue. This is very important for the breast cancer patients and their radiotherapy treatments.
I understand. Please tell me, doctor, is radiotherapy indicated in any form of cancer?
Yeah, this is a good question, Lisa. As I said, radiotherapy can be given in different stages of cancer, in different types of cancer. Let me give you an example.
Please.
The aim may be to facilitate surgery, because sometimes a tumor may enter to the normal tissues, and the surgery is not possible. But by giving radiotherapy before surgery, the tumoral tissue is smaller, and then it is easy to remove it by surgery. Thus, we can give radiotherapy preoperatively to facilitate the surgical resection. This is one aim. Secondly, as I said, radiotherapy is equal to surgery. I gave you an example. A head and neck cancer patient, laryngeal cancer patients. Instead of taking out of larynx by surgery, we leave the larynx in place and we treat by radiotherapy and preserve the organ. And the patient preserve his phonation, can speak normally. This is the second way. Radiotherapy can be given preoperatively before surgery. Radiotherapy can be given instead of surgery.
A lot of advantages, doctor. I said earlier that was my last question, but
Yeah.
I want to hear more and more and more. So, one more question, please. This is the last one. Is radiotherapy? You spoke about about the toxic procedure earlier. Is it painful? Is it safe for the patient with the cancer?
Of course, 5-10 years ago, we were giving radiation therapy, and we were not sure very much of is it the correct place we are treating or not. But nowadays, there is a technology called image guidance. It means that we know exactly before each session of radiotherapy if we treat the right location or not. This is nowadays possible with technological achievements, and the machines carry image guided radiation therapy technology in them. And we before starting irradiation, we get a picture of the field, see if it is the correct place or not, and then do the radiation treatment. We are very safe. Toxicity, of course, radiation can be considered as a surgery without scalpel, without knife. You know, uh, surgery necessitates anesthesia, and patient is hospitalized for several days, and then after surgical resection, a special care is necessary. 1 week, 1 month. Radiation is a surgery while the patient is walking without entering any operating room, surgical room. And there may be some side effects during radiation treatment, of course. We know these toxic effects, and we give treatments beforehand in order to alleviate these toxic side effects of radiation during treatment. There may be esophagitis, mucositis, diarrhea, nausea, vomiting, fall of hairs, such kind of toxicities. But these are all simple toxicities and they are manageable easily.
And the advantages are more important
Yes.
after all. These
Yes.
are the side effects, unfortunately, but the cancer problem is may be resolved due to radiotherapy. Thank you very much, doctor, for
Thank
all these
you. I
precious
thank you.
informations. Have a nice day.
Thanks, Lisa. Bye.
Bye. A fost așadar, doamnelor, domnilor, profesorul dr. Cengiz Gemici, medic specializat pe radio-oncologie. Am vorbit, așa cum ați sezizat, despre ceea ce înseamnă procedura de radioterapie aplicată bolnavilor de cancer. Până data viitoare, la o nouă întâlnire cu un alt medic de top din Turcia, vă doresc numai bine. La revedere!